This is Dr. Thomas Klein. I'm a specialist in chronic and rare diseases. I'm coming to you from Raleigh, North Carolina. Today we have topic number 13. Everyone should go to a pain clinic. That's the myth. Is that true? Well, we'll look into that in the next few minutes. Why are there pain clinics? I've been doing this more than 40 years and I don't remember any pain clinics. They've sort of popped up in the last 3 years since the CDC unauthorized guidelines kind of suggested that people with pain shouldn't really be going to their doctors anymore because doctors really were responsible for this opioid epidemic. That's not true. Never was true. In fact, they kind of got a little egg on their face when they issued the guidelines in March of 2016, claiming that overprescribing, writing too many prescriptions by doctors was causing the crisis. In fact, the number of prescriptions had been dropping off for 5 years. So the correlation was reversed. They should have said the epidemic was due to reduction in prescriptions, which is probably true. Because if you don't prescribe to people, then they'll find the stuff elsewhere, like on the streets. Oxycodone tablet costs about 75 cents. In the pharmacy, it's sold for $30 on the street. Pretty good business model. So Congress is really behind this. Congress responds to moral problems. People see junkies, heroin addicts as morally corrupt. They're not. They have a real disease. As we've talked about before, they have a genetic disease that's triggered by the opiates, not by being exposed. Here's what Congress says. They really directed the Food and Drug Administration to do more about opioid abuse, misuse, diversion, overdose, and death. That's the view of Congress in terms of practicing medicine. We have to remember that heroin addicts and opiates are medical issues. This is not building bridges. This is about medicine. So the pain clinics came along basically when the CDC said that pain medicines are not really effective. As a matter of fact, I just heard an interview with Dr. Deborah Dowell from the CDC, which is an agency that takes care of infectious disease. And she said, basically, opiates are not the first line drug anymore. 5,000 years we've been treating pain with opiates. And Dr. Dowell and the CDC thinks something has changed. What actually changed? Their thinking changed, and their biases and their prejudices changed. Nothing else has changed. So on to the pain clinics. The pain clinics are unregulated. Anybody can start up a pain clinic. And why would doctors start a pain clinic? Well, we did some surveys of the 30,000 on Twitter, and we found out that it looks like they're doing a lot of spinal injections with steroids. As a matter of fact, only 1/3 of pain clinics prescribe medicines unless you get an injection first. A third don't even prescribe medicines at all. So what they're after is doing these injections in your spine. A friend of mine went over to UNC. There was a huge room with little curtains. People were getting their spinal injections. Why do people like doing these? They're $1,000 a piece. Takes 10 minutes. I would much rather be in that business than struggling with sick patients. They don't follow up, they don't do anything, they just poke needles in their spine with steroids, which sometimes work for a short period of time. But what they're not taking into account is the fact you go squirting steroids in people's body, you're going to suppress their adrenal gland. Your adrenal gland you need when you have physical stress. You go to the emergency room with a broken leg and your adrenal glands are not working you can lower your blood pressure and die. Urine tests are done in 94% of people. What is it that they're looking for? What they're looking for is what the CDC has suggested they do. It's called mitigation. In other words, you're watching out for dope fiends, people becoming addicted. But anybody who's watched number 1 and number 2 of this series knows once you are on an opiate and you have not shown signs of addiction, you will never in your life ever become addicted. So every single patient going to a pain clinic will never addict. Never. So we do these urine tests to find out if they're cheating. Cheating what? These are poor, sick people with these horrible diseases. Cheating on what? These were tests that were designed for addiction clinics. These are not things that people have normally. 50% of people were told they couldn't have a pain medicine until they had an injection. That's half. So doctors send patients from their practice into these pain clinics to manage their pain when they could simply manage them in the office. I have for 40 years. If you get stuck, you go to a consultant. 66% of people responded to a Twitter poll and said they lost their doctors at the pain clinic. Pain clinics are raided all the time by the DEA, closed down, and so here you are stuck. Your own doctor won't do it, and the pain clinic doctors are abandoning you. So how about these urine drug tests? Very inaccurate. And then they're used to kick people out of the practice. Once you're kicked out of the practice, you are a pariah forever. Very bad practice. And Medicare was paying $150 each for them, so this was a real big money maker. Along with the $1,000 for the injections, no wonder clinics were popping up on every corner. They make you sign a contract. It so happens one of my patients had to go to a pain clinic, and she'd scribbled some notes on the pain contract and said, you would be insane to sign off on this vague waiver of privacy. Ridiculous clause, basically signing away your HIPAA protections. They went ahead and got her medical records before she showed up at the clinic. Contracts. There is no other medical procedure that I know of that requires contracts. The contract is that you have to rush over to the pain clinic with your pills so they can count them. If they're off by 1 or 2, which means that you may have had to take some for a bad flare-up, too bad. They stipulate you go to the same pharmacy. What's that all about? Oh, doctor shoppers go to more than one pharmacy. But wait a minute, these people are not going to be doctor shoppers because none of them will ever addict. 60% of doctor shoppers, by the way, are people not getting enough pain medicine. Here's a pain contract. You can't smoke marijuana. It's legal in some states. It does not interact with any of the medicines. So what are they doing? They're limiting people from not using marijuana in states where it's legal. Trying to get into the clinics are really pretty tough. One person went to the Froedtert Hospital in Milwaukee, big teaching hospital. Patient went there and was immediately told that no narcotic medication would be administered no matter what, and that she would just have to suffer. So they have a pain clinic, but they don't treat pain. Looks like pain clinics are causing pain. Here is a pain clinic at the ARMC Pain Management Center in Burlington, North Carolina. This is a 17-page interview format with all kinds of, you're going to do this and you're going to submit to this whether you want to or not. And you can only go to one pharmacy, and we don't think there's any kind of an emergency about pain medicines. There are people who write very nice articles about the fact that contracts and random drug testing for people with chronic pain, think twice. But the big problem is the people in the pain clinics are people who will never addict. So next time we're going to talk about benzodiazepines, the newest radioactive drug from the CDC, the Center for Infectious Disease, who has no standing whatsoever to be making any recommendations about prescription drugs. That's up to the FDA. Thank you.